As nurse practitioners, we have the privilege to be influential as sources of information, support, and guidance for people living with diabetes, as well as their family members. Our language plays a very important role in healthcare as we strive to provide care that is person-centered and benefits the health outcomes and psychological well-being of an individual. The way we talk to people with diabetes really matters. Some words can increase empowerment and engagement. Other words can be hurtful and may impact a person's physical, mental, and social well-being, even if those words were used unintentionally. In the scenes that you are about to see, a nurse practitioner talks to a person with type 2 diabetes in different ways. The first example uses language in a way that is not as effective as it could be. Take note of the words and phrases that the nurse practitioner uses and how their choice of language might be affecting the person with diabetes. Diana Stevenson is a 35-year-old woman with type 2 diabetes. She was diagnosed last year and is here to follow up. Her current hemoglobin A1C is 8.2%, up from 7.8% last year. She is currently taking 500 milligrams of metformin twice a day.
Good afternoon, Ms. Stevenson. My name is Kathy, and I'm going to be your nurse practitioner today. What brings you in?
Hi, it's nice to see you again. I'm here because of my diabetes.
Okay, yes, I do see here that you are diabetic. How long have you had diabetes?
Well, I was diagnosed last May, but it was very upsetting for me.
Oh, I'm sorry to hear that. I'll start by asking you questions regarding your disease. So I see here that the medical assistant just performed a diabetic foot exam on you, and I will go over those results at the end. Are you testing your glucose levels in the morning and evening?
Yes, I brought my log with me. I have my morning fasting levels and my evening levels.
Perfect. This is helpful for me to understand how well controlled your glucose levels are. So what I see here in your record is that your fasting glucose levels are ranging between 140 to 160, and your evening glucose levels are ranging between 170 to 200. These numbers aren't the best. This correlates with the increase of your A1C, indicating poor control of your diabetes. Are you compliant with your metformin?
I do take my metformin every day, but I may skip a pill here and there just because I don't like those bad side effects, like diarrhea.
Yeah, most of my diabetic patients complain of the side effects of metformin, but metformin is a very effective medication for most diabetics, and I can change it to an extended release form for you. That should help with those unwanted side effects. However, because you've only been on metformin for a year and your A1C is still elevated, it seems that you've failed on metformin. I'll escalate treatment and start you on a second medication. You can take metformin and the other pill once a day in the morning with food.
Do you really think this other medication will help me?
Well, if you want to avoid those diabetic complications, you need these medications. Some of those complications could include blindness, nerve damage, or stroke. Adding a second medication should help you to better gain control of your diabetes.
Okay, I'll give it a try. Is there anything else I can do? I know I gained some weight over the past year, and I've joined a gym because I've been trying to lose it.
Yeah, well, good question. Well, you know, diabetes is a lifestyle disease, and there are many actions you can take to lower your A1C and prevent complications. Well, what I see here is that according to your chart, you gained almost 15 pounds since the last time I saw you. Your BMI is now 29, which makes you almost obese. You should start exercising more to lose weight. I want you to lose about 1 to 2 pounds each week. Sticking to a regimen of healthy exercise and healthy eating will help with correcting those glucose levels and gaining normal control of your A1C.
All right, that sounds like a good plan. I'll give it a try.
All right, well, let's go over the foot exam results. So what I see here is that there's no indication of an infection and you have sensation in all parts of your feet. That's very good. Diabetic patients have to be very careful with their feet, and you should be checking them daily. You don't want to end up with a diabetic foot because that can lead to an amputation.
Yes, I do remember us talking about this last year. I've been really good about wearing shoes and socks in the house as well as outside.
Okay, perfect. Well, let's wrap this up. So what I'll do is I'll start you on a second medication, and that can be taken once a day in the morning. And then I'll change your metformin to an extended release form, and you can take that also once a day. Continue working on losing weight, and hopefully these changes will show us better numbers next time I see you. So I want you to come back here in about 2 months, and we will reevaluate a plan of care for you. And before you leave, do you have enough supplies at home, such as test strips?
All right, sounds like a good plan, and yes, I do have enough supplies.
Okay, perfect. So I'll go ahead and grab diabetic education pamphlets from my office. And if you have any concerns or questions, feel free to call the office.
All right, thank you so much.
Now the same two people have a very different version of the same conversation. Take note of the words and phrases that the nurse practitioner uses and how their choice of language might be affecting the person with diabetes.
Good afternoon, Ms. Stevenson. My name is Kathy, and I'm going to be your nurse practitioner today. What brings you in?
Hi, nice to see you again. I'm here because of my diabetes.
Okay, yes, I do see here that you have type 2 diabetes. When were you diagnosed?
I was diagnosed last May, but it was very upsetting for me.
Well, what are your thoughts about it now?
Now, I'm doing much better. I've joined support groups, and that's really helped me.
Well, I'm glad to hear that. I'm going to start by asking you questions regarding your diabetes. The medical assistant just performed a foot exam on you, and I will go over those results with you as well. Are you monitoring your glucose levels in the morning and evening?
Yes, I brought my log with me. I have my morning fasting levels and my evening levels.
Perfect. This is helpful for us to understand how well controlled your glucose levels are. Well, what I see here in your chart is that your fasting glucose levels are ranging between 140 to 160, and your evening glucose runs between 170 to 200. These numbers are a little above the target range. How are things going with your medication? Have you been able to take metformin twice a day as prescribed?
I do take metformin twice a day, but I don't like the side effects it gives me, like diarrhea. When I get those side effects, I may skip a pill or two, and it could be a day or two off the medication.
Well, thanks for telling me that. Diarrhea is a common side effect of metformin. One option is to take an extended release form of metformin once a day. This helps most people get rid of that unwanted side effect. Would you like to try it?
That seems like something I could do.
Okay, well, let's discuss your A1C. As you know, the A1C shows your average blood glucose levels over the past 3 months. More importantly, it gives you an idea about the risk for complications related to diabetes. When you are diagnosed, your A1C was 7.8%. Today, it is 8.2%. This indicates that the metformin may not be doing enough to lower your glucose levels. In order to reduce your risk for diabetes-related complications, it's recommended that your A1C be below 7%. How do you feel about that?
I do understand that I really need to reduce my A1C to limit those complications, so I'm really interested in doing anything I can.
Okay, let's discuss options. One option would be to add another medication. Combining 2 medications can be more effective with decreasing your blood glucose levels. You could take the new medication once a day in the morning with the extended release form metformin. What do you think about that?
Do you really think adding another medication will help me?
You could choose to continue taking metformin twice a day, and when we meet up next time, we can see how your A1C and glucose levels are running. You could also choose to take the extended release form of metformin once in the morning. Many people find that they need a second medication to do the trick, and adding a second medication will most likely bring your glucose levels and A1C down to a safer range. Lowering your A1C also reduces the risk of diabetes-related complications, such as blindness, nerve damage, or stroke.
Okay, I think I'll give this new medication a try and this extended metformin. I know I've gained some weight over the past year, and I've joined a gym just to try to lose that weight. Is there anything else I can do?
Well, congrats on joining a gym, and good question. There are many actions that you can take to lower your A1C and reduce the risk of complications. We can work together to create a plan that fits well in your daily life. According here in your chart, your weight has gone up about 15 pounds since the last time I saw you, and your BMI is now 29, which is higher than the recommendation. Exercise is an important step. How often are you going to the gym?
I go with a friend, and we go about every 2 or 3 days. She's just that extra motivation I need.
Having a workout buddy can be very helpful, and I'm glad you have someone to join you. May I make a suggestion?
Yes, of course.
Many people find that aiming to lose 1 pound per week is easier than setting a bigger long-term goal. Making small changes and healthier choices can lead to your A1C goal of 7%.
All right, that seems like something I can do.
Now to go over the results of the foot check the medical assistant did. There are no signs of an infection, and you have normal feeling in all parts of your feet. That's very good news. People living with diabetes have to be very careful with their feet. I suggest wearing well-fitted shoes or sandals, even inside the house, and that you check your feet daily for cuts, redness, blisters, or other changes to the skin or nails. These actions can decrease your risk of developing diabetes-related foot ulcers.
Yes, I do remember us talking about this last year. I've been really good about wearing slippers in the house and socks and shoes when I leave the house.
That's great. Okay, so to wrap up, I'm going to start you on a new medication once a day in the morning, along with the extended release form of metformin. You've also made some tough choices and changes. Keep it up and you will likely see a decrease in your A1C level and fewer swings of your blood glucose levels. Do you want to check back in with me in about 3 months? We can review your blood glucose levels and see how things are going. Before you leave, do you have enough monitoring supplies at home?
That sounds like a good plan. And yes, I do have enough supplies.
Okay, and would you also be interested in diabetes education materials that you can read at home?
That would be very helpful.
All right. Well, if any questions or concerns come up, feel free to call the office.
All right, thank you.
In the first scene you just saw, the nurse practitioner used language that interfered with their ability to deliver quality health care and achieve the goal of helping the patient. Examples of less effective language include using the word diabetic, which is a label and describes the person as a disease. Saying poor control, which is a judgmental term when referring to diabetes, A1C, or glucose levels. Using compliant or non-compliant, which can imply that people are uncooperative or to blame, and it makes it about following rules or beliefs set by the provider. Referring to diabetes as a lifestyle disease, which can imply judgment. In the second scene, the nurse practitioner used language that is more effective and encourages the patient to be actively involved in making decisions about their health. Examples of more effective language include saying, "You have type 2 diabetes," which puts the person first and avoids describing the person as a disease. Using phrases that establish trust and build a relationship. Using neutral and fact-based phrases like target glucose levels and glycemic target, because referring to normal glucose levels implies that levels outside of this range are abnormal. Using phrases that invite the person to discuss any challenges or side effects to medication. Using the phrase, "you could choose," which gives the person options emphasizing choices and recognizing autonomy. Remember, the way we talk to people with diabetes really matters. Words matter.